All right, this is my presentation on hepatitis B. A little background why I chose this virus. When I was growing up in the 90s, it was one of those viruses that pretty much started to take off, and it was well known and talked about when I grew up in school and at home. I was always told to make sure I'm washing my hands properly and watching what I touched and not to eat after anybody. All these things were told to me, and it kind of jogged my memory when when we were told we had to do this presentation. So that's just a little bit background on why I chose the topic, and we're going to go ahead and jump right into it. So the outline of my presentation is as followed. We're going to first talk about the virus name. Then we're going to talk about the causes of the disease, the symptoms, treatments, how the virus is transmitted, what is the reservoir for the virus, and then we're going to talk about whether the virus the genome is either a single stranded, double stranded, or RNA or DNA. Hepatitis B is a liver infection caused by the hepatitis hepatitis B virus, which is also known as HPV. The hepatitis B virus is transmitted when blood, semen, or another body fluid from a person infected with the virus enters the body of someone who is not infected. This can happen through sexual contact, sharing needles, syringes, or other drug injection equipment, or from mother to baby at birth. For some people, the hepatitis B is an acute or short-term illness, but for others, it can become a long-term chronic infection. Risk for chronic infection is related to age and infection. Approximately 90% of infected infants become chronically infected, compared with 2 to 6% adults. Chronic hepatitis B can lead to serious health issues like cirrhosis or liver cancer. The best way to prevent hepatitis B is by getting vaccinated. All right, some of the symptoms that are present with acute HPV infections can include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay colored bowel movements, joint pain, and jaundice. To the right there, I have included a slide of what hepatitis B looks like under the microscope. As you can see, it looks pretty nasty. Looking at it from that view. All right, some treatments recommended by the advisory committee is administration of hepatitis B vaccine and hepatitis B immune globulin for infants born to HPV infected women within 12 hours of birth, um, followed by completion of the vaccine series and post vaccination serologic testing. Um, the universal hepatitis vaccination for everyone else would be within 24 hours of birth, followed by the completion of the vaccine series. Vaccination of children and adolescents less than 19 years old who have not been vaccinated previously is also recommended. Newly acquired acute HPV infections can only cause symptoms some of the time. The presence of signs and symptoms varies by age. Most children under 5 years and newly infected immunosuppressed adults are generally asymptomatic, whereas 30% to 50% of people age less than 5 have signs and symptoms. So just saying, pretty much just saying that uh, kids or people under 5 usually show the signs and symptoms. Some acute HPV infections will resolve on their own, but some will develop into chronic infections. Most people with chronic HPV infection are asymptomatic, and have no evidence of liver disease. However, some people may develop chronic hepatitis, elevation of their ACT and ALT, cirrhosis, or hepto, hepatocellular carcinoma, which is a type of liver cancer. All right, this slide right here is just a picture of some of the most common drugs or uh, treatments that people with hepatitis B are prescribed. Um, I think it's kind of interesting, and I still need to do more research on my end. Um, what happens if they do become resistant to these drugs, and what are the other options for treatments? But right now, from the main research that I've done, these are some of the most popular treatments and antiviral drugs that are used to treat and also used to prevent liver damage. All right, transmission of the virus. HPV is transmitted through activities that involve percutaneous, which is puncture through skin or mucosal contact with infectious blood or body fluids, such as semen and saliva. It also can be transferred or transmitted by having sex with an infected partner, injection drugs that involve sharing needles, syringes, or drug preparation equipment, birth to an infected mother, contact with blood or open sores of an infected person, needle sticks or sharp instruments exposure, and sharing items such as razors and toothbrushes with an infected person with HPV. It is not spread through food or water, sharing eating utensils, breastfeeding, hugging, kissing, hand holding, coughing, or sneezing. This slide pretty much is a picture of just informing people on how they need to be vaccinated. Um, I think it's interesting that only from what the slide says, only 62% of people living with hepatitis B have been diagnosed, and many have no symptoms. So that leaves quite a bit of people out there that probably don't even know that they have it, and then people who haven't been vaccinated, that also leaves a big number of people out there for that as well. Uh, it was one of those things where people were, like I said, in the past, it was one of those big viruses that people were, aware of, and it was out there. But right now, it's not as talked about as it was in the past. So to go into the point that I was making, this chart right here shows, starting in 1980, how the virus itself progressed and how many reported cases of HPV there were out there. As you can see, in the early 80s is when it started to pick up, and then throughout the 90s, and then slowly it started to decrease in the 2000s. All right, what is the reservoir for the virus? People are usually the reservoir for the virus. HPSAG may remain detectable for life in many patients. Individuals who have positive findings for the HBsAg are termed carriers of HPV. They may be inactive carriers or they may have chronic hepatitis. Anti-HPC is present in all patients with chronic HPV infections. HPV AG and HPV DNA may or may not be present. They reflect a state of active viral replication. HPV DNA levels are typically low or absent in inactive carriers. HPV DNA levels are higher in patients with chronic hepatitis B, and high HPV DNA levels are associated with increased infectivity. So that means the chronic patients usually are going to have a higher DNA level, which would also reflect them being infected, but also reflect them being able to infect somebody else or the ability to infect somebody else. All right. So this is the last slide of the presentation, and it's pretty much going to talk about is the virus a genome is the genome of the virus a single strand, double strand, RNA, or DNA. This one was very interesting to learn about and very complex in my words, but I'll go ahead and go over this last slide with you all. Um, Although HPV is one of the smallest viruses in terms of virion and genome size, it has numerous unique features that make it completely distinct from other DNA viruses. It has a partially double-stranded DNA with highly complex genome organization, life cycle, and natural history. Remarkably distinct from other DNA viruses, it uses an RNA, an intermediate called pregenomic, uh, pregenomic RNA, which is short for pgRNA, and a reverse transcriptase for its genome replication. Genome replication is accomplished by a complex mechanism of primer shifting facilitated by direct repeat sequences, including the genome encoded in the genome. Further, the genome has evolved in such a manner that every single nucleotide of the genome is used for either coding viral proteins or used as a regulatory region or both. Um, so that just shows you why. Just reading that, that means that this virus is able to replicate and reproduce and replicate. It looks like it will. So that would explain why once you get it chronically, that it's pretty much only treatable and not curable. Um, as of now, I'm pretty sure with science we will one day be able to do it. But with reading that, that's really to me it's really impressive that it will be able to reproduce and replicate, in such a manner. Um, and this is my last slide here. Pretty much this is just showing a picture of what we just talked about, how it's double stranded, um, and pretty much the makeup of the virus itself. These are my references. I will have a handout for you all to go over those if you want to see where I got some of my information from. And these also include my images where I got some of those from as well. Um, Thank you, and I hope that this was um, able to hold your attention. And thank you.